this is the dengue season, so there should be no stagnant water around your house. Cover yourself because dengue can be very sickening. If you have fever with severe joint pain in this season, most likely it is chikungunya. If it's low, then don't take painkillers. But if it's normal, in consultation with doctors, just have the painkillers, rest. That's what chikungunya is.
Are you tired of getting sick frequently or worried about monsoon virals? Welcome to Health Decoded, Your Health Decoded. We're diving deep into common health problems affecting all of us. And joining us today is Dr. Tickoo, who will give us practical tips, debunk health myths, and show you how small changes can make a huge difference. Dr. Tickoo, thank you so much for being here today. Tell us, as someone who sort of lived in Delhi, practiced in Delhi, what are the most common health concerns that people come to you with?
Well, in a city like Delhi, with us general physicians, it's a mixed bag. Infectious diseases, environment, pollution-related issues, lifestyle-related issues. Now, if you talk about lifestyle, then diabetes, because of poor sedentary lifestyle, poor eating, lack of exercise, obesity, we see too much of diabetes, hypertension, even in young people, for that matter, even in adolescents. And,
in adolescents, is hypertension.
Obesity. Hypertension, because it comes with a host of other issues as well. Then, as I said, obesity, insulin resistance, these are all lifestyle issues that we have to deal with. Apart from that, then infectious diseases, this is the monsoon season, mosquito-borne diseases, dengue, chikungunya, and then infectious diseases are waterborne diseases, which are very common during monsoons because of contaminated water and food. You get typhoid, you can get hepatitis A or E, and viral fevers, flu, which is more common in the urban setting, right through the year, more so in winter. And then tuberculosis also, though it's more common in lower socioeconomic group, but we do see a lot of tuberculosis even now. So it's a mixed bag. Then pollution-related issues, you have asthma, you have COPD, you have allergic rhinitis, people are sneezing, coughing, eye allergies, more so during the smog.
So in this season where, everyone's worried about, I'll get a viral, people are sneezing, like you said, there's gastritis going around. What are some common precautions people can take to sort of stay healthy during this time where infections are more common than perhaps during other times of the year?
See, if you talk about general health, then you have to follow a regular diet, balanced diet, exercise, sleep well, boost your immunity, cut down on alcohol. If you're smoking, quit smoking. But if you talk specifically about monsoons, waterborne diseases, then be careful with water, drink bottled water, and when you go out, eat at hygienic places. And this is the dengue season, so there should be no stagnant water around your house. Cover yourself well. You can use insect repellent creams because dengue can be very sickening. So these are the precautions which one has to take, and annual flu shot so that you prevent yourself from getting flu. These are the kind of things that one should be doing.
So, one of the questions that someone asked me today, because you spoke of flu shots, I thought I'll pivot to that, is that please ask Dr. Tickoo that 30 and above, what are the vaccinations an adult should have? Like we all know, when kids are born and they go through, but 30 and above, what are the vaccinations a person should have?
See, a flu shot is meant for everyone, 6 months and above.
From what age?
6 months and above.
6 months.
Yeah,
oh, really?
Yeah.
Every year?
Every year, annual flu shot.
Right.
Then for adults, it's actually, if you have risk factors like COPD, asthma, then you need a pneumonia shot.
Okay.
Then you also need shingles
Every
vaccine.
year?
No, that's just two
One.
shots.
Okay,
but
two
that's
shots.
for 50 and above.
Okay, 50 and above.
See, for 30 and above, it's mostly flu.
Okay.
And hepatitis B is part of the national immunization schedule. So most of us do take it, but there's a way of checking the immunity. So you can do a titer. And so you need hepatitis B shots if your titers are less than 10.
Right.
So more or less it depends on your risk factors. But broadly, if you say 30 and above, it's mostly flu.
Flu.
But 50 and above, then comes the shingles, then comes the pneumonia shots, especially if you have chronic issues, diabetics, especially that group really needs these vaccines.
In this, you spoke about risk factors, and so in terms of general health checkups, what would you advise people? Like, when should they start getting an annual general health checkup? And again, depending on age, how often?
See, annual health checkups depend on your age, your medical history, your risk factors. And so if you talk about 18 to 40 age group, I would say every 2 years, a basic blood check. 40 and above, an annual blood check is a must, especially if you have risk factors like diabetes, hypertension, or if you're a smoker, or if you consume alcohol, or there's a family history of cancer, heart disease. 50 and above, I would say it's a must. It's not an option. One has to do an annual blood check. And it's not only the blood check. Maybe you'll have to do specific cardiac check, a CT calcium score, a stress echo, HSCRP. They tell you about your risk factors for heart disease. Then cancer screening, PSA for men above 50, then mammogram, pap smear for women, colonoscopy, which people are hesitant to do in India, but abroad it's the run thing after 50 for both men and women. So it should include everything, I would say. And then when it comes to blood tests, apart from the routine tests like cholesterol, sugars, vitamin levels, now there are certain cancer markers. I mean, it all depends on you have to sit with your doctor, tell him your medical history, and then figure out what tests. If you have risk factors like diabetes, or if you have a history of cardiac history in the family, then you might have to do tests more often. Maybe every 3 months, 6 months. But broadly, if you ask me, 40 and above, annual.
Okay, I want to sort of come back to the monsoon illnesses and dengue, etc. When should one worry about dengue? Because, you know, very often you get it checked, but a lot of people are treating it at home. What is that worrying marker for dengue?
See, in this season, if you have high-grade fever, body ache, headache, pain in the eyes, which is very typical of dengue. You can't,
pain in the eyes?
Yeah, eyeballs. It's very typical. So you should not ignore it. So you can take paracetamol. That's the safest for a couple of days. But beyond that, don't self-medicate. Don't take painkillers because they can lead to drop in platelets. They can cause gastritis, vomiting, which can create lots of complications in dengue. So beyond 2 days, get in touch with your doctor. Get a test done. There's a dengue NS1 antigen. From day 1, it can come positive. Don't start taking antibiotics. This is what majority of people do. No antibiotics, no painkiller, just paracetamol, lots of water. Water is the key in dengue. That's one point you have to emphasize on. If you drink a lot of water, at least 3, 4, 5 liters of water every day, you will not land up with complications in dengue. So what happens is, if you are dehydrated, your hemoglobin falsely goes up. Like if your hemoglobin is 12, it goes up to 14, 15. Your platelets drop, the bleeding tendency increases, and the liver dysfunction, multi-organ failure can set in. So if the early diagnosis is the key, if you do the test on the first, second day, within the first 2, 3 days, you know it's dengue, at least you'll start drinking too much of water. You'll stop taking painkillers which can harm you during dengue. You'll start monitoring your platelet count. And the warning signs are breathlessness, bleeding from any side, abdominal pain, persistent vomiting, dehydration, drowsiness. If you have any of these signs, or if your platelet count is less than 50,000, or if your hemoglobin is increasing, then you need admission for intravenous fluids. And all that.
Chikungunya.
Well, chikungunya, we haven't seen it in the last couple of years. I mean, too much of chikungunya. But there was 1 year I particularly remember when there were like host of cases. It is generally not life-threatening. The only problem with chikungunya is it gives you joint pains, which can last for a month to years. So again, high-grade fever, body ache, and pain in joints. That's very typical. If you have fever with severe joint pain in this season, most likely it is chikungunya. And again, there's a test, a PCR test. First day, second, it can come positive. And treatment is basically, now with chikungunya, you can give painkillers because it usually doesn't cause a drop in the platelets.
And it possibly helps the patients.
And it helps the symptoms also because pain is the main symptom. So again, in the first couple of days, paracetamol. Once you know it's chikungunya, your platelet count is normal. If it's not normal, if it's low, then don't take painkillers. But if it's normal, in consultation with doctors, just have the painkillers, rest. That's what chikungunya is. Generally not life-threatening, like dengue.
Okay, so these two, because they're talked about a lot, what else should people be worried about during this particular season?
Waterborne diseases. Like typhoid. It's so common in a city like Delhi. We see it round the year, not only during monsoons or the summers, because people eat out a lot, they order food and with ice, and you don't know the source, the drinks that they have, so you end up with typhoid. So typhoid is because of contaminated water, food. Then hepatitis. We do see a lot of hepatitis. Hepatitis A, hepatitis E, which is waterborne. And again, flu.
Viral hepatitis, same.
Viral hepatitis, there are 4 types.
Okay.
A and E is due to water. Contaminated water and food. And B and C are bloodborne. So through blood, contaminated saline
So
needles.
both of these, then again, doctors, antibiotics, early detection.
No, not for the viral hepatitis. Self-limiting, no specific medication. But again, early diagnosis is the key, because if your liver dysfunction sort of increases, then you are a high risk. You can end up with fulminant hepatic failure, which can be fatal. So early diagnosis, you know your liver enzymes are pretty high. You keep drinking lots of water, high carb.
So what are the symptoms of
persistent nausea, yellowness in the eyes, dark yellow urine, fatigue.
Can that be mistaken for jaundice?
Pain in abdomen. Yeah, jaundice is hepatitis. Jaundice is a symptom. Jaundice is like yellowishness.
Right.
So it's due to hepatitis.
Right.
No, poor appetite, nausea, abdominal pain, dark yellow urine is hepatitis most of the time. So there's a test again. Day 1 you can check. No specific treatment, but once you know you have it, so you'll be more careful. Many times you need admissions for IV fluids because you're not able to drink enough.
And typhoid?
Typhoid again is waterborne. It's a bacterial infection, unlike hepatitis, which is a virus. So antibiotics
are needed
2
for
weeks.
that.
2 weeks of antibiotics. And the test, see, what people normally do is they go for a test called typhoid, which is not a confirmatory test. They go for Vidal test, which is not done in the first 1 week, and they think it's not typhoid. But the gold standard for typhoid is a blood culture. If you grow the bacteria on the blood culture, it's typhoid for sure. And then, because typhoid can get messy in the second week, it can cause complications, intestinal perforation, pneumonia, myocarditis, so many things can happen. So antibiotics for 2 weeks and you are done. If you don't complete the course, there can be a relapse. So it's very important that you know it's typhoid, because otherwise after 5-6 days, once your fever settles, you'll think it was a virus or something like that, you stop. And then you'll again have a relapse. So tests are very important, I would say.
And within the first 4 days.
For 2 days you can take it easy, but after that, and don't self-medicate, don't take antibiotics. That's the biggest problem in our country. People self-medicate, they take antibiotics, and then the bug won't show up in the cultures.
Right.
And you'll never know what it was.
And now there's also a lot of talk about how antibiotics are actually not affecting people because they've taken so many, the whole thing away.
There's a lot of resistance, multi-drug resistance.
Okay, now I wanted to ask, is it the same for adults and for children, or in both the groups we have to look for different things? Because, parents get extremely worried about kids in this weather, and so...
See, fever is the main symptom, whether it's adults or children. And with children, they become dull, they don't play much, the appetite goes down. So, but more or less, I would say symptoms are the same.
And the diseases are the same also. It's this that, there's nothing different that we have to look for.
There are certain viruses which affect children mostly.
Like?
Hand, foot, mouth disease. These are self-limiting viral illnesses. They don't usually affect children. But there are, most of the viruses affect both adults. And we see quite a few Epstein-Barr virus infections also.
Which is, if you could...
The disease is called infectious mononucleosis. The virus is Epstein-Barr virus. It can cause fever for a prolonged period of time. So recently I saw but it's not that common. It's not that every other person is having it. But many times when you see patients of fever of unknown origin, they don't know why they have fever. All tests are negative. It tends to be that. EBV. There's a test, EBV PCR, to detect it. So you won't unnecessarily have to do a CT scan. You won't have to unnecessarily take multiple doses of antibiotics because it's again a virus. It's self-limiting.
So there's nothing as if, you just have to wait it out, I suppose.
So clinical diagnosis is fine. You have to go with what the doctor thinks, but then do the tests. In our country, people are still a little hesitant in getting the tests done. They think it's not needed, but it is.
Okay. So apart from all of this, you spoke about lifestyle diseases like diabetes and obesity. So speak to us a little bit about that. When patients come to you, is again medication the only way, or is it through diet and through other ways that initially you advise patients to go that route?
Well, diet, exercise is very, very important, I would say. And when it comes to diet, a balanced, nutritious diet, whole foods like whole grains, fruits, vegetables, legumes, nuts, seeds, low carb diet, almost cut down on the sugars, bring it to zero almost, low salt, and
you're taking joy out of everyone's life right now.
Saturated fats you have to cut down. Too much of alcohol you have to cut down on. If you're smoking, then quit smoking. Exercise, 30 minutes of brisk walk, cycling or swimming 5 days a week, 2 days of strength training. Even when you've had a meal, go for a 10-15 minute walk. Take the stairs instead of the elevator. So exercise, diet, then again, sleep is very important. 7 to 9 hours of sleep. You should have fixed timings. When you go to bed, when you wake up, even on weekends. It's not that it's a weekend so you oversleep. So, and your place where you sleep should be sleep friendly.
No, so till what age can we get away with it? 30, 40, or is it,
I think it's a way of life for everybody. I mean, once you inculcate these habits, they take you through. But if you have these bad habits...
No, is there, like at 40, I can start behaving myself?
I would say yes, because post 40, you tend to get these issues more often. And it also depends on your lifestyle, your family history and things like that. So post 40.
Okay. Another thing that everybody wanted to ask about was chronic fatigue. Saying that in urban areas, in cities like Delhi, there are a lot of patients who come with chronic fatigue. Now, what is that about? Speak to us a little about that.
It's a broad term, fatigue. There can be so many reasons for fatigue. But if you ask me as a physician, what do I see in the OPDs? Most of the times it's B12 and D deficiency. Though D doesn't cause that much of fatigue, but it gives you aches and pains and reduces your immunity. But when it comes to B12, see, I think 1/3 of our countries are vegetarians. So B12 deficiency is very common in India. So you get those symptoms, you get fatigue is the most common symptom, headaches, migraines, hair loss, memory issues, anxiety, panic attacks, backaches, leg pains, digestive issues. You get everything because of B12 deficiency. So that's the first and foremost thing that I would check. Do a basic blood check. Don't jump to bigger tests like MRIs and CT scans. That comes much later. Do the basic stuff first. And then you have to see, does he have any infections? Is there any other illness does he have a cardiac issue? Screen him for diabetes, screen him for heart disease. What is the family history? Is there cancer? Is he stressed? In today's day and age, most of the times, if it's not what I spoke about, then it's stress. The kind of work pressure, job insecurity, family demands, everybody is like, and if you talk about professionals and students, insomnia, burnout, sleep disturbance is so common, I can't tell you. Every other person who's a professional or who has a active job or demanding job
it's not sleeping.
Has a lot of stress and they need these sleep medicines and then they get hooked onto it. So we have to be very careful regarding all that. And then they do over-the-counter stuff, which doesn't most of the times work. So much of misinformation.
That's, by the way, that's, as we sort of come to the end of this, that's what I actually wanted to really ask you, because so many of our viewers said, how reliable is information online? Now you have AI and ChatGPT and all these great AI engines that are just spewing out. How much can one believe it? Because everyone, like you said, is just self-medicating.
See, you have information available just at the drop of a hat. Like you just do one click and you have all the information, but more than information is misinformation. So don't go by the advice of these influencers or these health blogs which don't have medical credentials, always look for the source.
Right.
Now it's coming from the top institutes like AIMS, WHO, CDC, Mayo Clinic, NHS. Then yeah, you have to go with what they are saying. You can rely on them. Again, there has to be scientific backing, research papers, consensus of experts, medical guidelines. And there's a host of things. You can't just go by what is out there on the social
Anyone
media.
saying what, yeah.
So you need a doctor to actually guide you. We are your health guides. So you need us to help you navigate through this health digital ecosystem. Otherwise, how do you know? There's an ocean out there.
Yeah.
So we have to tell you, we have to discuss with you. You can't dismiss off what see, most of the patients Google and come and then they want to quiz you. So, so you have to sit with them and tell them what are the facts,
Right.
what are the myths, and make them understand. Show them, share videos with them, maybe blogs with them. And you should be open to discussion, I would say. But you need somebody to really guide you.
So you're getting quizzed by patients all over again. These are sort of, you're taking your medical tests all over again.
Yeah, with Google and ChatGPT.
Yes, everyone is now, and then people come and say, I actually got this and my doctor didn't know, but I got this. But anyways, I want to do a quick wrap up for our audience on everything that you said, which is that 6 months and above, that's number one. Everyone has to take the flu shot. That's a must, right?
Yeah.
And then there are hepatitis B shots, but that depends on risk factors and tests.
Generally part of this immunization schedule, but very important vaccine.
Very important vaccine, so that's one. 50 and above, there's the shingles vaccine. There are pneumonia shots, especially if you are sort of prone to other risk factors, like if you're diabetic or you have cardiac illnesses and things like that. 18 to 40, do a basic blood check. And that's fine, you're good to go. 40 onwards, an annual checkup. 50 onwards, the checkup is must. It's not just a basic blood checkup, but also other
cancers,
depending on what your doctor says.
Issues,
yeah. Okay. Dengue. Don't ignore symptoms. Get yourself tested and don't take antibiotics. Water is key. The more water you drink, the better you will be. Okay. I'm going to really look at my notes. Typhoid and hepatitis, again, get yourself tested. Don't ignore symptoms is basically what you're seeing, because things can get really bad. And last but not the least is that you can go read up whatever you want on Google and on ChatGPT, but best consult your doctor.
Yeah, absolutely.
Right?
Yeah.
That was lovely. Thank you for being here today. If you have questions that you would like answered, if you have questions, we can get Dr. Tickoo back. So write to us. You can write to me at manika@decoder.com and we will take your questions to Dr. Tickoo and other experts. But that's it for Your Health Decoded. See you again next week.